Hey, my name's Wesley. I'm going to be your nurse today.
Okay.
And I'm just going to perform some hand hygiene. Alright. Alright, can I get your name and date of birth?
It's Charles Shepard,
Charles.
5/17/1978.
Alright, awesome. Well, first I just want to make sure that your room is safe. It looks like the room is well lit. Looks like the pathway to the bathroom is clear. Just going to get this rug out of the way so that we don't have any tripping hazards. It looks like your call light is within reach. So yeah, everything looks nice and safe. Are you experiencing any pain today?
Yes.
You are experiencing some pain, okay.
Yes.
Alright, what would you rate your pain at? What level? On a scale of 0 to 10, 0 being the worst, 0 being no pain at all, and 10 being the worst.
2.
Alright, pain's at a 2. Alright, and how would you describe your pain? What is it, burning,
Yes.
throbbing?
It's like a burning sensation.
Okay. And where is your pain located at? What region of your body?
Back. Upper back.
Upper back? Okay. And how long has this been going on?
About 3 years.
About 3 years. And what were you doing when the pain started?
Archery.
Archery. Okay. All right. Is there anything that makes the pain better or worse?
Rest.
Rest. Rest makes it better?
Yes.
Okay. And how does this pain affect you in your daily life?
It keeps me from doing some things I like to do, exercising, stuff like that.
Okay. All right. Okay. All right. Next, I want to get your respiratory rate. We're going to start your respiratory assessment, and I'm just going to start with your respiratory rate.
Okay.
I'm going to use your watch. Alright, we'll flip this over if that's okay.
That's cool. Here, let me take
Actually,
it
yeah,
off.
can I just
Yeah.
take that off?
Sorry. You're good. Okay.
Okay. Alright. So let me get your respiratory. Your pulse rate.
Okay.
So we're actually starting your cardiac assessment, not your respiratory.
Okay.
Alright. Your pulse rate is 68 beats per minute. And it was a 2+ strength. Now I'm going to check this one over here.
Okay.
Alright, that one's also a 2 pulse strength.
Okay.
And now I'm going to check your pedal pulse.
Okay.
That's a 2+. That's a 2+. Now I'm going to check your post tip. That's a 2+. Check this post tip over here. That's a 2+. Okay. So yeah, all your pulses are looking good. Can you stand up so we can demonstrate some of the other pulses? Alright, so right here we have the carotid pulse on both sides. In the armpit we have the axillary pulse on both sides. We also have the femoral pulse on both sides right here. Right here we have the brachial pulse on both sides. And then right here behind the knee we have the popliteal pulse on both sides. So if you'll take a seat for me, I'm just going to inspect for JVD real quick, jugular vein distension. So if you'll just kind of turn your head that way. Alright, that looks good. Let me do this side. Okay, that looks good. Alright, now I'm going to check your fingers for capillary refill. So we just want to make sure you got good circulation.
Okay.
Alright, now I'm going to be checking your arms and legs for edema.
Okay.
Just see if there's any swelling. listen to your heart.
Okay. Sounds good.
I'm gonna get some heart sounds. Okay. Okay, the heart sounds good. No adventitious sounds.
Okay.
And the last thing for the cardiac assessment is I just need to ask you, have you had any chest pain lately?
No.
No chest pain.
No chest
Okay. Well, we're going to move on to the respiratory assessment.
Okay.
The first thing that I want to do is check your respiration rate, okay?
Okay.
So, if you'll just take normal breaths for me, okay?
Okay.
All right, respiration rates are 12. All right. All right, next we're going to listen to your breath sounds.
Okay.
So, first we're going to start in the right upper lobe. Just take nice deep breaths. All right, left upper lobe. All right. Left lower lobe. Right lower lobe. All right. Right lateral lobe. And left lateral lobe. Okay. We'll move to the back side. All right. Right upper lobe.
Excuse me.
Left upper lobe. Left lower lobe. Right lower lobe. Okay. All right, breath sounds are normal.
Okay.
I don't hear any wheezing or anything like that. Alright, so next I just wanted to kind of educate you on some things that will help you with your breathing. We have what's called the turn, cough, and deep breathe. So it's just really important to make sure that you're turning every so often, just to keep those lungs clear. Make sure that you're taking deep breaths and then also giving us a really good cough. So not a soft cough, but just a really forceful cough, just to kind of keep those airways open.
Okay.
Right here, we have an incentive spirometer.
Okay.
And so this is just a device that you can use. You want to make sure that when you do it, that you inhale like you're inhaling through a straw.
Okay.
And you want to do that 10 times every hour when you're
Okay.
awake.
Okay.
And this just helps to prevent pneumonia. Okay, so we're going to leave this here with you on your table. So just use that when you're awake 10 times every hour.
Okay.
Have you had any coughing?
No.
There's no coughing? Okay. And then have you had any trouble with breathing or anything like that?
No.
No trouble breathing?
No.
Okay. All right. Well, now we're going to move on to the musculoskeletal part of this assessment.
Okay.
So we're just going to test your range of motion on a few different areas.
Okay.
So if you will just, we're going to do your neck. We're going to test this one first.
Okay.
So if you will just bring your neck, if you'll just look up for me as far as you can,
Okay.
that's hyperextension. And then if you'll kind of bring it down a little bit more, that's extension. And then if you'll bring your chin down to your neck, that's flexion. Okay. And then we're just going to test it for strength also.
Okay.
So if you'll try to put your ear to your shoulder.
Okay.
Okay. And we'll do it on this side too. Okay. All right. Strength is good. I'm also going to do your elbow.
Okay.
We're going to test your range of motion.
Okay.
So if you'll just extend your elbow all the way out,
Okay.
that's extension. And then if you'll just kind of flex it for me, that's flexion.
Okay.
Alright, so that's extension and flexion, so those look good.
Okay.
And then I also am going to just test your strength. So if you'll do flexion for me,
Okay.
and then try to push down for me.
Okay.
Alright, that's a good sense of strength.
Okay.
Alright, and then we're going to do your range of motion on this side also.
Okay.
So if we'll do extension and then flexion.
Okay.
Alright, we're going to test your strength on this one. Alright, that's good.
Okay.
Alright, now we're going to do two parts on the lower part of your body.
Okay.
So we'll start with your knee.
Okay.
So if you'll just do extension for me, where you stick your leg all the way out. Alright, that's extension. And then if you bring it back in, that's flexion of the knee. And do the same thing on this side.
Okay.
Extension, flexion. Okay? Now, I'm going to push your leg out a little bit, and I want you to try to pull your leg back to the chair. We're going to test your strength.
Okay.
Okay? Now try pushing this way. Okay? Same thing on this side. Alright. Alright, strength's good there. And now we're going to do your ankles. Okay?
Okay.
So, if you will point your toes to the sky,
Okay.
that's dorsiflexion. And then point them down, it's plantar flexion. And then if you'll kind of spin your foot, that's circumduction.
Okay.
Okay. Same thing on that side, point it up, flexion. Actually, dorsiflexion, plantar flexion, and then circumduction. Okay, and now I'm just going to kind of press, and you try to push up.
Okay.
Okay, let me do it on this side too.
Okay.
Alright, strength is good in both ankles. Alright, now I'm just going to test your gait.
Okay.
So if you will just stand up and just kind of walk towards that way and then back for me. I'm just going to watch you walk to make sure your gait's good. Alright, it looks good. Now I'm going to test for balance. So if you'll just stand right here for me, make sure that you're standing straight, your arms are just kind of hanging by your side, and you're going to shut your eyes.
Okay.
And I'm just going to count to 30 seconds. And basically you just want to try to stay as still as possible without swaying, okay?
Okay.
So go ahead and shut your eyes. 30 seconds starts now. Alright, so your balance is good. You passed the Romberg test. You'll have a seat back for me. Alright, and so I just need to ask you a question for this part of the assessment.
Okay.
Have you been having any type of joint pain?
No.
No joint pain.
No.
Alright, well now we're going to move on to the GI part of this assessment. So first we're just going to, all of this inspection all of this assessment is going to take place in the abdominal region. So if you'll just
Okay.
kind of scoot up for me
Okay.
a little bit. Alright, so the first thing I want to do is just kind of inspect the skin. When you're inspecting the skin, it's important to look from 2 different angles, just to check the contour and make sure everything looks normal. Alright, everything looks normal. It looks flat. The stomach's not distended. There's nothing protruding. It doesn't look like there's any scars. I don't see any wounds. The skin looks like a nice even color. The hair distribution's normal. So everything looks good for the skin. I also just want to auscultate your bowel sounds
Okay.
in each of the 4 quadrants. So we're going to start in the right lower quadrant. It's important when you're listening to bowel sounds to make sure you listen for 1 minute. And if you don't hear anything, listen for 5 minutes. Alright, bowel sounds are normal. Now I'm going to go to the right upper quadrant. Bowel sounds are normal. Left upper quadrant. Bowel sounds are normal. Left lower quadrant. Bowel sounds are normal. Alright, now I'm going to listen to your abdominal aorta.
Okay.
Just to see if there's any bruits. Alright, no bruits. Alright, and now I just have to palpate the 4 quadrants.
Okay.
Just to make sure there's no firmness, no rough spots, no hernias, different things like that. So
Okay.
we're just going to kind of palpate in each of the 4 quadrants. Okay, everything looks good there.
Okay.
Doesn't seem like there's any tumors or firmness or anything out of the ordinary. When's the last time that you had a bowel movement? Do you remember?
Yes. Yeah. This morning.
This morning? Okay. And are you able to still pass flatus?
Yes.
Okay, so you haven't had any trouble with that. And then my last question is, have you had any stomach problems recently that we should know about?
I have not.
No stomach problems. Okay. And then the last part of this assessment is for the genitourinary part. And it's just 1 question. Have you had any problems urinating? No. No. Okay. All right. Now we need to move on to the HEENT and the neuro assessment.
Okay.
So first thing I want to do is just kind of inspect your head and your face for symmetry and shape. Everything looks symmetrical. Have you had any headaches often?
No.
No headaches, okay. I also want to inspect the symmetry of your ears. So it looks like the tops of the ears are lined up right with the corners of your eyes. So they look good. Alright, let me do the whisper test. I'm going to whisper just 2 numbers in your ear.
Okay.
And if you'll just repeat those back to me.
7, 5,
That's correct.
3, 2.
Alright, that's correct. Alright, have you had any hearing loss?
No.
No hearing loss, okay. Next I want to assess your pupils. So first I'm going to check for accommodation. So if you'll just kind of follow this around with
Okay.
with your eyes. Okay. Alright, it looks like the pupil size is about a 5. Alright, now I'm going to test to see if they are reactive to light. Alright, looks like they went from a 5 to a 3. Okay, and I'm also going to check this one, just in
Okay.
case. Okay, looks like it's about a 5 again. Alright. and it looks like it went down to about a 3. So it looks like both eyes are equal, and the pupils are equal and responsive and reactive to light and accommodation. So both the eyes went from a 5 to 3 millimeters. When's the last time you had an eye exam?
6 months ago.
About 6 months ago. Okay. All right. Now I'm just going to kind of inspect your nose,
Okay.
just to check for symmetry. Okay. All right. Nose looks symmetrical, and I'm just going to actually let you do this. If you'll just close one nostril and breathe in through me. Breathe in. Okay. And do the other one for me. Okay, both nostrils, the nose is patent. Have you had a loss of smell?
No.
No loss of smell, okay. Next, I'm going to inspect your mouth.
Okay.
Just to kind of check everything. Looks like the mouth is pink and moist. Alright, if you'll smile, let me see your teeth. Alright, the teeth look straight and white. Okay, and then if you will swallow for me. Alright, patient can swallow. And then if you look up, I'm going to check your neck again. We've already checked for JVD, but I just want to make sure for symmetry and that the trachea is midline. So everything looks good. Let's see. Do you know what your name is?
I do. Freeman Shep.
Alright, and do you know where we're at?
Yes, I'm home.
Alright, do you know what time it is? Or actually, do you know what year it is?
Yes, 2022.
Okay, and do you know why we're here today?
For a physical assessment.
Okay, so patient is alert and oriented ×4. The last thing I need to do is explain the Glasgow Coma Scale. This just evaluates the patient's level of consciousness after a brain injury using a point system. You haven't had a brain injury, so we don't have to do it, but I did want to explain this to you. But we check for 3 different things. We check for eye-opening response, verbal response, and motor response.
Okay.
So that's called the Glasgow Coma Scale. But anyways, thank you so much. You've been a wonderful patient.
Thank you.